Brook Lane has a unique and interesting history, like no other nonprofit in this area. It started during World War II, when a corps of conscientious objectors across the United States chose to fulfill their military obligation by performing civilian public service rather than serving on active duty. The government assigned these men to large projects. Some were assigned to help in state mental institutions. What they saw there were deplorable conditions. A May 1946 issue of Life magazine exposed the situation and described the mental health hospitals as little more than concentration camps. Wards were so crowded that the floors could not be seen, and patients were naked and were restrained with straps and locks. The Mennonite community rallied to the cause, and the church developed a vision of care for those with mental illness based on the theology of healing. A committee was created, and a master plan called for 3 locations throughout the country. The proposed eastern site was a 115-acre farm in Leitersburg, Maryland, that previously served as a CPS camp focused on soil conservation. A number of buildings already existed along a dirt lane that ran parallel to a small winding brook. The Leitersburg proposal was approved, and the site was named Brook Lane Farm. A 23-bed hospital was built, and the first patients were admitted in January of 1949. The farmhouse served as both a dining and living room and included offices and 2 apartments for staff. The early staff was almost exclusively volunteers and conscientious objectors who all lived on the farm. As the facility had a dual nature of psychiatric hospital and working farm, the staff and patients worked side by side, washing and ironing clothes, cooking, baking, cleaning, gardening, planting and harvesting crops, and completing construction and maintenance work. Just 2 years after opening, the census at Brook Lane Farm increased beyond bed capacity, and in 1952, construction began on a new wing of the hospital, increasing the total capacity to 38 beds. Due to the increase in patients, the dining capacity exceeded the original farmhouse. In 1956, a new kitchen and dining room building was constructed. Under the direction of the Mennonite Advisory Committee, Brook Lane Farm incorporated in 1959 with its own local board of directors and changed its name to the Brook Lane Farm Hospital. As the organization continued to grow, a separate administration building was constructed in 1960. In 1961, a dormitory for the women staff members and volunteers was built, called the Laurels. Due to the draft being in effect, the staff was still mainly comprised of those who lived and worked on the farm as they completed their voluntary service. In 1962, the chapel was built and dedicated. Throughout its growth, Brook Lane continued to embrace religious principles as the core of its culture. In 1964, the Emma G. Musselman Clinic was completed. This clinic was in addition to the administration building, and it was built for the purpose of housing inpatient and outpatient therapist offices. Another name change came in 1965, when Brook Lane Farm Hospital officially became Brook Lane Psychiatric Center. The military draft ended in 1973, resulting in a reduced volunteer base, which led to the Laurels dormitory being converted into outpatient office space. This allowed Brook Lane to expand to meet the growing mental health needs of the surrounding community. In 1980, the west wing of the hospital was designated as an adolescent unit, and in 1984, an 8-bed geriatric wing was added to the hospital. Between 1987 and 1992, there were 3 major additions to the Laurels. In 1987, a 16-bed child and adolescent hospital was built adjacent to the Laurels. In 1989, a 6-bed children's unit was added along with a playground. These 2 additions are now where our partial hospitalization program is located. In 1992, 2 wings were also added. The first was an 8-bed adolescent unit, which now houses the child and adolescent partial hospitalization program. The second was a waiting room and administrative space for outpatient services, which now serves as the main entrance and lobby area of Laurel Hall School. In 1993, an outpatient satellite clinic opened off the main campus that today is called North Village. The Laurels was converted from an outpatient services location to Laurel Hall Special Education School in 1994. In 1997, Brook Lane Psychiatric Center changed its name to Brook Lane Health Services to better encompass all of the various programs and services provided. The first decade of the new millennium brought with it many new programs and services for Brook Lane. In 2004, construction was completed on a large expansion to the hospital, making single occupancy rooms available for all patients and bringing the total number of rooms to 42. This expansion also created 3 separate units for children, adolescents, and adults. In 2008, a second Laurel Hall School opened in Frederick. This location also included a small suite of outpatient therapy offices. Also in 2010, Brook Lane began offering an annual calendar of continuing education seminars to help area mental health professionals meet their licensure requirements. Today, that calendar consists of 10 offerings per year for roughly 1,000 attendees, a quarter of which are Brook Lane employees. In 2011, a partial hospitalization program for adults opened on the main campus. In 2015, construction was completed on a hospital unit for young people, as well as a new wing for outpatient services on the main campus. In 2018, InStep, an integrated substance use treatment program, began at the North Village location. Brook Lane added transcranial magnetic stimulation as an innovative addition to our interventional psychiatric line of services in 2022. Brook Lane won the Nonprofit of the Year Award at the Washington County Chamber of Commerce 2023 Business Awards. Brook Lane expanded its services to Allegheny County by opening an outpatient clinic in Cumberland in the fall of 2023. And, most recently, Brook Lane held a ribbon cutting for a new 7-bed child and adolescent high-acuity residential crisis program. Over the past 75 years, Brook Lane has never stopped responding to the mental health needs of the community. Today, with nearly 500 employees, Brook Lane is Western Maryland's largest nonprofit mental health system. The main campus in Hagerstown, Maryland, is home to the second largest freestanding psychiatric hospital in Maryland, serving children, adolescents, and adults. Brook Lane has a high-acuity residential crisis program for children and adolescents, partial hospitalization services for both adults and children, and operates Type 1 and Type 3 special education schools in Washington County, as well as a Type 1 school in Frederick County. Brook Lane's 3 outpatient clinics in Hagerstown, Frederick, and Cumberland offer psychiatry services and therapy for all ages. The InStep program provides outpatient and intensive outpatient options for individuals with substance use treatment needs. Our school-based mental health program embeds Brook Lane therapists in most of the Washington County schools, ready to provide needed therapy on-site for those who need. Brook Lane also continues to be the leading provider of mental and behavioral health continuing education seminars and free community programs in this region. Building on a strong foundation, Brook Lane embarked on a new chapter in July 2024 through its official affiliation with Meritus Health, a fellow leader in community healthcare. This affiliation culminated from an extensive evaluation process designed to identify how each organization could best leverage its strengths to address the evolving mental health care needs of this region and state. By joining forces, Brook Lane and Meritus Health have created a comprehensive care network that integrates clinical excellence with a shared commitment to our community's values. I don't know about you, but I can't wait to see what Brook Lane accomplishes in the next 75 years.